If you get into your 20s or even your 30s and you've still got acne, in this situation, I would advise that this is no longer sufficient and you should consider a long-term option, of which we used to only have isotretinoin, but now fortunately we also have AviClear. So there are pros and cons to either of them. Isotretinoin has been around since the 80s and we know it works, there's no doubt about it. However, it has got a list of side effects that are quite long and a little bit sobering. Most of them do not happen, to be honest, in my experience, but we obviously have to still let patients know about them. So for instance, in women of childbearing age, if you were to become pregnant whilst on isotretinoin, you're highly likely to have congenital problems with your child. And so you do need to be on effective contraception, and this is all very strictly monitored with regular pregnancy tests, etc. In addition, it needs blood test monitoring because it can affect your liver and the fats in your blood, and it causes dry skin and dry lips in pretty much everyone. In some patients, it can cause a low mood. This is a little bit debatable, as large-scale studies have shown that actually most patients with acne do get improved mood once their acne improves, but we still have to warn patients, and there's some patients who will not be suitable for it on this basis. Such patients I would therefore recommend AviClear for. AviClear is a laser which targets the oil glands in the same way that isotretinoin does, but via a light source rather than chemically, and the advantage it has is that it can be used in patients for whom isotretinoin is relatively contraindicated. Example, those with a history of mood disorder or who are prone to anxiety. Those who do not want to take contraception for whatever reason, because some people do get low mood with hormonal contraception as well. Sometimes they're sports men or women who are worried about the muscle aches and joint aches that you can get with isotretinoin. Those who do not want chemicals for whatever reason, among others. So there are good alternatives now for adult acne. In addition, I would consider adding anti-androgens in females in the form of spironolactone, and we can do topical spironolactone for both men and women as well.